Julia Wilmot here, and I'm here to show you some simple, gentle release work you can do for your lower back. When women particularly, there's a close link between lower back pain and pelvic floor dysfunction, which we go into in more details in my programme. But I just want to show you first some simple take-home releases you can do for your lower back to help alleviate tension. So first of all, on all fours, if you're comfortable to come into all fours, just want to check our knees are beneath our hips, our wrists are beneath our shoulders. You want to have a nice neutral spine and draw the shoulder blades gently away from your ears. This is called the hip rainbow. So you're going to lift the right foot, keep the knee on the floor, rotate your thigh bone inwards as you tap outside your mat. Then you're going to draw your rainbow as you lift the leg and tap it over the other lower leg. And you keep going, drawing those rainbows right and left for about 6 to 8 pairs or more on each leg. And this can help alleviate tension in the back of your pelvis. Okay, so that's number one. So obviously you'd repeat on the other leg as well. Some other really nice releases are when we come onto our back. So to come safely onto your back to help with your spine, you come onto your side first if that's comfortable, and then roll over onto your back, or any way you know that's comfortable for you to come onto your back. So we're going to bring one knee at a time up to the chest if that's okay for you. Modify if you need to. One hand is on each kneecap. You're going to take a breath in, and as you exhale you're going to gently draw the knees towards your chest. And then you're going to allow them to release away slightly. So still with the hands on the knees, you just allow them to release away a little bit. So we're going to take a breath in again. As we exhale, we're going to gently draw the knees into the chest. So we're getting that nice lengthening of the lower back muscles and the glutes as well, and release. So again, commonly in women, is what's called glute gripping, where we kind of hold tension in the glutes a bit too much, feeding into that lower back tightness. And again, in my programs, we look into that more deeply and learn how to release those glutes. That way we can then start working our pelvic floor and core better as well. So let's just do 2 more. So as we exhale, we draw the knees into the chest. Inhale, release. And 1 more. Exhale, draw the knees into the chest. And inhale, release. Lovely, good work. Okay, popping the feet on the ground now. We want to come into what's called neutral pelvis. So this is where you want your hip bones and your pubic bones to be level with each other. So if you make a diamond shape with your hands like so, place the heels of the hands on the hip bones, the knobbly bits there, and the fingertips on the pubic bone. And you want to have the fingers and thumbs level. So if perhaps your pelvis is pushed too much into the ground, you're tipping the front of the pelvis too much to your chest, just modify. Equally, if you've got too much of an arch in the lower back and your fingers are lower than your thumbs, then just adjust towards your head until your fingers and thumbs are level. So in nice neutral pelvis, going to relax the arms down, maybe the back of the hands on the floor. Going to take a deep breath in. And as you exhale, you're just going to allow the pelvic floor muscles to soften, allow the tummy to soften, just let it go. And again, take a deep breath in. And as you exhale, allow your pelvic floor muscles to let go, the tummy to soften. Well done. Now on the next one, we're going to tilt the front of the pelvis gently towards the chest. But I'd like you to try and do it without gripping your buttocks. So think more about an internal lift of the pelvic floor, or drawing down through the tummy muscles, gently imprinting the lower back into the floor as you tilt the front of the pelvis towards the chest. So should we give it a go? Okay, so take a deep breath in. Now as you exhale, I want you to imagine that you're stopping yourself from breaking wings, so drawing through the back passage. And stopping yourself from weeing, drawing in from the front passage, and also lifting up through your vagina as well. So you feel a nice contraction, engagement of the pelvic floor and the tummy, and then gently just tip the front of the pelvis towards your chest. Gently imprint the lower back into the ground. Now release, relax the pelvic floor and tummy, and tilt the front of the pelvis back to neutral where you started. So now we've let go of the core, muscles are relaxed, pelvis is in neutral. Should we go again? So take a deep breath in. As we exhale, we're going to close in through the back passage, the front passage, and lift up through the vagina. Lift, lift, lift. Tummy on as you gently press the lower back into the floor without gripping through your thighs or glutes. Lengthening the lower back as you tilt the front of the pelvis towards the chest. And then release on the inhale, just let it go. Well done. And you could try, say, 6 to 8 reps of those to begin with. See how it feels for you. Getting that nice lengthening to the lower back, and also connecting with our core muscles and gradually learning how to do that really well to create movement in the pelvis, that engaging and that letting go. So I hope that helps. There are also lots of other strategies, lifestyle strategies for us to implement to help manage back issues. And there's a case for seeing a women's health physio, which again I give guidance to in my programs. So do subscribe if you want to see more pelvic floor exercise workouts with me, and I'll hopefully see you next time. Take care.